And for anybody who hasn't seen it yet, I want to refer you to a good video that's on YouTube about COVID-19. This is by Dr. Duc C. Vuong. He is a surgeon, medical doctor, and the title of the video is called How COVID-19 Kills. I'm a surgeon and why we can't save you. So if anybody hasn't seen that video yet, go over there and watch the whole thing. It's about 35 minutes long. It was uploaded on March 23rd, 2020. And it now has over 14 million views. So if you want to get some good information that you're not going to get anywhere else, especially the mainstream media, I would definitely recommend you going there and watching this video as soon as possible. Like as soon as you finish watching this video would be best. One of the great uncertainties we still don't know about this virus and about this disease is what the immunity is that people are expected to be able to build up after they're infected. So it's a range. We don't really know what immunity, if any, people are going to have to this thing. The worst case scenario would be we build up very little immunity at all. So if we get infected once, we can get infected again. It's going to be this is probably the scariest thing about this illness right now is, if we don't build up immunity to it and it just keeps hammering away at us, we keep getting infected over and over and over again. I can't even begin to describe, or I can't even begin to imagine how much damage this thing could end up doing if, healthy people, even healthy, strong people, are getting infected over and over again. You might be able to withstand one infection, but a second infection and a third infection, it's unconscionable. It's inconceivable. So, hope for the best that, we do build up some immunity for this thing. I think we will. I think we do. Here is a slide from the University of California. This is from Matt Dougherty. It's one of the slides that he made during a presentation. You can find this on YouTube as well. There is a limited amount of immunity that we build up to it. Of course, that's probably on a curve as well, too. Some people might build up more immunity to it than others. They might have a better immune response. They might have more protection from getting infected a second time than other people do. I mean, we really don't know. So, what the range is, what the variability is, what your chances are of having reliable immunity. It will protect you if you've already been infected once and you've recovered from the virus. Here are the coronavirus statistics as of April 11th, 2020. This is Saturday night. This would be the night before Easter Sunday, 2020. These numbers are going to be quickly obsolete, but looking at where we are right now, about 1.78 million people have been tested positive for the coronavirus. About 108,770 have died, and about 402,709 have recovered. So the percentages there, I think, are more telling than the absolute numbers. We see that 6.1% of cases, tested positive cases, have resulted in death. 22.6% of cases of tested positive cases have recovered. I've been looking at these numbers for a long time. I've been just looking at them for days, looking at them for weeks, and I keep expecting the total number of recovered cases to rise tremendously fast in proportion to the number of deaths. I mean, I want to see that recovered statistic. I want to see that 22.6% rise to 50%, 60%, 70, 80, 90, 92, 93, 95%. And below those global statistics, we see a breakdown by countries. I listed the countries sorted by the number of infected or the number of tested positive. And right now we can see that the United States of America is just way out in front. It's just, blowing every other country away as far as how many people it has infected. So it's way out in first place. This is not the race that you want to win, but United States is winning in spades. Number of deaths is now 20,555. Number of recovered, 29,818. 3.9% is the highest percentage death rate that I've seen yet. Unfortunately, it's more than doubled in the past couple of weeks. It was below 2% a couple of weeks ago. So now I think it was about 1.6%, 1.7% in America. Now we're up at 3.9%. with 5.6% recovered. So I really want to see that 5.6% just increase, just, exponentially. I want to see that number just take off. I want to see that 29,000 just blow away that 20,000. And I'm just not seeing it. It's like every single day I look at these numbers and I'm just not seeing that movement. And, the more I look at these numbers, the more I freak out. So I do expect the recovered percent to increase dramatically. I'm still waiting for it, but, I still believe 100% that number is just going to explode. And if you look down at China, they have numbers similar to what I'm expecting to see. The death rate is far, far lower than the recovered percentage. So that 94.5% gives me hope. If China can throw this thing back, it proves that we can beat it. It's beatable. Hoping also, though, that China is giving accurate information. There's been a lot of noise being made lately in a lot of sources that China is not coming clean with the true data, and what they're reporting is not a reflection of the truth. I do think that other countries on this chart, like on this page, let's look at Spain, Italy, France, the United Kingdom. I think they are telling the truth. I think it really is that bad, and I don't think they're making it better than it really is. I don't think they're making it worse than it really is. It's really hitting those European countries hard. I mean, we can see double-digit death rates for all of them. Spain at 10.2%, Italy 12.8%, France 10.7%. The United Kingdom, wow, this is unbelievable, 12.5%. So they're knocking on Italy's door as far as how well they're handling this right now. Got Belgium down there at 11.9%. So Europe getting hit especially hard. Probably the best case to look at, which isn't on this page, I think it's on the second page, is South Korea. So if we can follow the South Korean model, listen to South Korea, do what the South Koreans did, I think that is close to or reliably right now the best case scenario and probably the best model that we should follow, and just take their advice and do what they did. Here's another chart. This is a line graph. Now, these charts come from the Johns Hopkins and the World Health Organization. So those are the sources for this information. We can see the top 10 countries with the highest number of infected. We have the USA in red. We can see the USA just skyrocketing in the number of test positives. So, this can mean a lot of things, and I don't want to play politics with these numbers. I don't want to cast blame. There's going to be enough of that going around to just fill everybody's heads up for years, and I don't really want to get involved in that, at least not in this video. Just demonstrating, though, that this, is bad. This is the number of infected people in this country. It doesn't really seem to be letting up. The distance between each dot represents 1 day, each one of those line segments. And what you would want to see is the line segments getting smaller or shorter and shorter and shorter, and we're not seeing that here in this chart at all. We're seeing, a very, very steep curve. The slope of this curve is very bad right now, and the distance between the line segments, of course, is very long, and it doesn't really seem to be getting any shorter either. We're just met by an incredibly steep curve and incredibly long line segments every day, and so not letting up in the U.S. yet. I see a lot of, what they're always talking about, flattening of the curves. I see a lot of curves for a lot of these other leading countries that seem to be, you can see the slope starting to flatten off. Hopefully, we're going to see plateaus. You see the orange curve, the China curve, which is just, you want to talk about flattening a curve. Well, there you go. That's the flattened curve. This doesn't mean that China is uninfected. It just means that they have stopped the number of infected people has stopped increasing at around 80,000 people. So at any given time through all of these days and these weeks that we see here represented on this graph, they have about 80 or 81,000 people walking around that are infected with the novel coronavirus. So hoping that data is legitimate and that they are telling the truth, and that flat curve right there can be believed. And if that is for real and they are telling the truth, and I hope to God that we can believe them, but if they are telling the truth, then hopefully the red curve, the United States of America curve, will flatten out, just as well, and we'll have, I don't know how many people infected at any one time. I mean, none of these curves seem to be going down. So, to expect ours to go down, certainly to go down steeply or quickly, just doesn't seem to be a realistic proposition. I mean, I think the curve is going to kind of flatten out, and it looks like where we are now, it's probably going to flatten out somewhere above 500,000 Americans, unfortunately. Here's yet another chart that really puts the number of infected into perspective. If you want to look at the relative differences between countries, you can see how bad the United States has been hit relative to anywhere else. There's been a lot of reporting in the media lately about the Trump administration cutting funding from health services in this country, even as late as February 10th. You can go back and look at old articles from, February 10th, 2020. You can go back and look at these articles talking about what the Trump budget was intending to be. They were intending to decrease federal spending on Medicare about $750 billion over 10 years. So that's $75 billion a year. There you can make some accounting changes, and the difference would be about $500 billion. But even that would be $50 billion per year, which is pretty significant. So significant cuts to Medicare, even more significant cuts to Medicaid. The budget called for $844 billion in savings over 10 years from the president's health reform vision. So that's about $84.4 billion a year in cuts to Medicaid, and that's February 10th. Of 2020. So this is, this was already well in the way of the coronavirus. The coronavirus was, well on its way at this time, and the Trump administration still wasn't getting it. So they were still cutting funds to America's health care, and they were diverting funds into other areas like fossil fuels and military spending. But, just the timing of this is so ridiculous. That they would even be doing this. This comes after news that we've been getting a lot lately too, which John Bolton disbanded the pandemic unit in this was March of 2018, and there was no reason given. So, the news coverage was a little bit silly on this as well. The director of this unit quit, and the news picked up on what happened, and they tried to smooth it over for Trump. Like Fox News, for example, was reporting that Trump didn't fire the guy. Well, yeah, he didn't fire the guy. They disbanded the unit that the guy was working for, and he decided to quit after that. There was no point in, once you bring this team of experts together, you have some of the best people assembled to help defend against a pandemic like the coronavirus. Instead, you break it up, and you take all of that potential, you take all of that expertise that's assembled in one place, and you scatter it to the four winds. You render it impotent. Now we're no longer able to send scientists to China before it's too late, but before the virus spreads across the entire world. We're too late to stop the virus from spreading in our own country by any appreciable amount. So all of this combined is just, whatever your politics are, this is absurd, and it's got to be called out. And if anybody would like to ask John Bolton, I don't think CNN is going to ask John Bolton. I don't think Fox News Channel is going to ask John Bolton. I don't think that MSNBC is going to ask John Bolton. But will somebody, please, call John Bolton and ask him why he disbanded the pandemic unit back in 2018 with no reason given. And of course, nobody asks any questions. Nobody seems to notice. Nobody seems to care. Well, how about now? Do we care yet? I think we're going to care. I think he is going to be asked. I don't know by who, but if somebody would like to step up to the plate, now would be a good time to do it. And it's even worse than that. It's not just 2018. It's not just February of 2020. Trump's been doing this kind of stuff all the way up to just the other day, just a couple days before Easter weekend.
We're going to put a hold on money spent to the WHO. We're going to put a very powerful hold on it, and we're going to see.
Is the time to freeze funding to the WHO during a pandemic?
No, maybe not. I mean, I'm not saying I'm going to do it, but we're going to look at it.
You did say that.
We give a tremendous... No, I didn't. I said we're going to look at it. We're going to investigate it. We're going to look at it. We're going to put a hold on money spent to the WHO. We're going to put a very powerful hold on it, and we're going to see.
And probably the most stunning little clip that I have here to share is the moment that Trump refused to allow a medical doctor answer a question about a drug, a medical drug that Trump has been touting for the COVID-19. It's called hydroxychloroquine. Trump has been basically, standing up on the bully pulpit and selling this thing to people. It's an untested drug. And refusing to allow his chief medical advisor, Dr. Fauci, answer a question about the drug, which is just stunningly irresponsible. I mean, it's just disgusting. Dr. Fauci was standing on the podium, ready to ask or answer a question. A member of the press was in the audience, asked him about the drug. Trump cut him off, wouldn't allow him to answer it. I mean, it was the most stunning, probably one of the most stunning things from this podium I've ever heard.
Why not just let the science speak for itself? Why are you promoting this drug?
I'm not. I'm just
You
saying,
come
very
out
simply, I'm not at all. I'm not. Look, you know what I'm trying to do? I'm trying to save
you come out
lives.
here every day, right, sir, talking about the benefits of
I want them to
hydroxychloroquine.
try it, and it may work and it may not work. But if it doesn't work, it's nothing lost by doing it, nothing. We don't have time to go and say, gee, let's take a couple of years and test it out, and let's go and test with the test tubes and the laboratories. We don't have time. I'd love to do that. But we have people dying today. As we speak, there are people dying. We bought massive amounts of it, 29 million doses of it. We have it coming from all of the labs. We're actually now doing it here because in case it does work, we want to have it.
And would you also weigh in on this issue of hydroxychloroquine? What do you think about this, and what is the medical evidence?
That question?
Yeah. Well, I'd love to
Maybe
hear from the
15,
doctor.
15 times. You don't have to ask the question.
He's your medical expert, correct?
He's answered that question 15 times.
Dr. Fauci, why are you not wearing a face mask?